implants. So implants, we're going to divide into three parts because it's a vast topic. It's very important for your exams, and it is very important for your understanding of the subject as well. And therefore, we will try and divide it into three parts, and we will do it one by one, as little as possible and with little more detail as possible. Right. So why do we need implants? Right. Very importantly, implants are required for fixation of the fractures. Sometimes you can do close reduction. Most of the fractures do not require any surgical intervention, and they get better without any surgery or open reduction or any kind of anesthetic involvement or OT involvement, right? But many fractures require reduction. They may require close reduction or open reduction. And when they require open reduction, many times we require something to fix these fractures in place anatomically or hold them in place anatomically. And these are called as implants. What material are these implants usually made of? They're either usually made of titanium or medical grade or a special type of stainless steel which is rust resistant. Stainless steel which does not rust. This is very important. Right? Now when you fix fractures of implant, there are two types of stability that we can achieve. One is absolute stability. This will be discussed in greater detail in another video, but this is an important concept to understand for implants and screws. And the second stability is relative stability. So in absolute stability, the strain that the implant or fracture undergoes is less than 2%. Strain is less than 2%. If the strain is between 2 to 10%, it is called relative stability. What are the absolute stability conditions? For example, like in lag screw fixation, in DCP fixation of forearm fractures. What are relative stability? For example, external fixation, for bridge plating, right? So in absolute stability, the fracture heals via primary intention, that there is no callus. Primary intention, it heals via primary intention, no callus. Whereas in relative stability, it heals via secondary intention and by forming a lot of callus. Now what happens if the strain is more than 10%? Then it goes into non-union. It forms fibrous tissue and then it goes into non-union. This is something you have to remember very important for implants, or any kind of implant. The more stable the implant is, the lesser callus formation happens. It heals by primary intention, and more the strain, that is more relative stability you get, the higher the callus that is thrown, and healing occurs via secondary intention. Right, now let us move on to screws. We will discuss the other implants in a different video. What is a screw? Screw is basically a long circular stainless steel or titanium material, and this converts rotational force into compressive forces, rotational or torque force into linear forces, into linear compressive forces. So a screw converts a rotational or torque movement into compression force, right? So these are various types of screws are available. Okay, the basic screw design is that it contains a central core around which a spiral of metal is welded upon or is made on. So it is a core which is made, maybe sometimes tapering, and a spiral of metal around it for holding the bone. So this is the basic design of the screw. Screws can be of various types. As I said, it can be stainless steel, medical grade stainless steel, which is rust resistant. It does not rust, right? In open air, these screws tend to rust. So this should not rust in the body, right? Second is titanium. Titanium is another common material from which screws and implants are made. You have two types of screws based upon the bone for which it is used. You have cortical screw, which is used for dense cortical bone, and cancellous screw, which is used for cancellous porous bone, where the pull out, so that it does not pull out and integrates well with the metaphyseal cancellous porous bone. So this can be short threaded or long threaded. See, the short threaded is about 16 millimeters and the long threaded is usually 32 millimeters. We also have cannulated screws like this. Usually for the cancellous screws, they can be passed over a guide wire, right? So if you want to reduce a fracture, you can temporarily reduce it with a guide wire, and then you can use the guide wire to drill over it using a cannulated drill bit and follow it up with a cannulated screw. So therefore, we also have what is called as a cannulated screw for the application of screws over a guide wire. Nowadays, new screws are all self-tapping screws. So they have chutes or flutes in the tip of the screw, which removes the debris as the screw moves forward. And these are called as self-tapping screws. Now let us come to the basic anatomy of a screw, right? The screw has the head. It has what is called as a shaft, right? So basically this is the head and the rest of it is the shaft. Now it has a core diameter, that is the central diameter. That is the diameter which is for which the drill bit is used. So for example, for a 3.5 millimeter screw, the core diameter is 2.5 millimeter. So the drill bit that is used to starting drill that is used is the 2.5 millimeter drill bit for a 3.5 millimeter screw, because the core diameter is 2.5 millimeter. whereas outer diameter is the diameter by which the screw is described. This, so these spiral grooves that you see outside is where the outer diameter is determined. It is about 3.5 millimeters in a 3.5 millimeter screw. So for example, in a 4.5 millimeter screw, the core diameter will be 3.2 millimeter. That is the drill bit size that you have to use, and the outer diameter is 4.5 millimeter. Right. The gap between two threads, between this thread and this thread, is called as the pitch. So every turn of the screwdriver will push the screw in by the depth of this pitch. So this pitch is less in case of a cortical screw because of the dense nature of the cortical bone, in which you need lesser pitch and more number of revolutions to push the screw in, and the pitch is more increased in case of cancellous bone, which is porous bone, metaphyseal bone. So you want it to integrate well and move. It moves much more easily. It is not as difficult as in the cortical bone. So therefore, the pitch is higher in case of or more in case of a cancellous cantilevered or cancellous screws. Right. So this is very important for us to understand. Now the head of the screw is of various types. The head of the screws can be of various types. The two most common ones that we use is star screwdrivers and hexagon. Very rarely we may have this cross or plus signed screws. These are used for small bones like metacarpals and phalanges. But the screw head shape in which the screwdriver sits into the screw head is usually either a star shaped or a hexagon type of screwdriver. There are some other special screws which we will discuss in a little detail in some other video. That is a headless compression screw. Previously it used to be called as Herbert screw, right? This is basically used for scaphoid fracture. What is this? What is the difference in the screw? There is a variable pitch. So if you can see, proximally the screw has smaller pitch, whereas distally the pitch is high. There is more space between the threads. It is more widely interspaced. So what is this variable pitch does? The pitch, because of this variable pitch, when you rotate the screw here, because of the variable pitch, this moves more and this moves less, and therefore compression happens. Because of this variable pitch, compression of the fracture happens. So this is very important. So it is called as a variable pitch. The two ends of the screw have different pitch. One end has less, one end has more. So distally it is more and proximally it is less, and therefore when you screw in, because of the variable pitch, compression of the fracture happens. This is an important concept to understand. The next thing is, how do you drill a screw, right? The first thing that you do is you use the drill bit of the core diameter. For example, let us take an example of a 3.5 millimeter screw. In a 3.5 millimeter screw, the first thing you should do is drill with a 2.5 millimeter drill bit. So when you drill with a 2.5 millimeter drill bit, once you finish drilling it, that is what you should do. Once you finish drilling it, the next thing you should use is the depth gauge. The depth gauge should be used to understand the length of the screw. So the working length of the screw is the length of the screw that goes across the bone, right? So when you measure a screw, you measure it from the tip of the head to the tip, from the head to the tip. This is the length of the screw that the depth gauge gives, and you should make sure at least one or two threads should cross the far cortex. The next step is you should use a tap. An appropriate size tap to make the threads in the dense cortical bone is used. Nowadays we have self-tapping screws, and therefore most of the times we don't use this tap. Self-tapping screws are available. But if the self-tapping screws are not available, it is a self-tapping screw, then you have to use a tap. So the first thing that you have to use is a drill bit. The second thing, you have to use a depth gauge, and then only use a tap. Following this, a screw is used to fix the plate to the bone. So this is how a screw is. These are different stages or the steps in applying a screw to a plate. Then next, very important question. Many of you might get about a 10-mark question in your exam regarding lag screw. Lag screw is a special technique. It's a technique via which you apply compression across a fracture site. Right? You apply the screw usually perpendicular to the fracture site. If you see, the screw application is perpendicular to the fracture site. The various steps in the application of the lag screw are, first is you have to make the gliding drill hole. See, the gliding drill hole should be the outer diameter of the screw, For example, a 3.5 millimeter screw, you should use a 3.5 millimeter drill bit for the outer gliding hole. Next, you should place a drill centering device, and then the distal or the far cortex should be drilled with the core diameter. So for example, in a 3.5 millimeter screw, if you want to apply, you have to use a 2.5 millimeter drill bit, which is the core diameter. Then you have to countersink, that is enlarge the hole on the top so that you get compression. If you don't countersink and you compress with the screw, you might break this, you might have a shearing force, and there you might break the cortex bone there. Then you have to measure the screw with the depth gauge and then tap. Here you will not need to tap the near cortex, only you have to tap the far cortex, because you have already drilled with the outer core diameter drill bit for the gliding hole or the near cortex. Next, you have to apply the screw, and because of the difference and because you have drilled differently, this screw will glide in the near cortex, whereas it will compress and pull the far cortex, and you'll have compression of the fragment. So this is called lag screw, right? So these are the steps. The first step is gliding hole or near cortex is drilled with the outer diameter of the screw. Then you have to drill the far cortex with the core diameter of the screw. Then you have to countersink, right? Then you have to measure, tap that far cortex and then apply the screw for compression. Lag screw provides absolute stability. Lag screw provides absolute stability, and therefore the healing is by primary intention. In many long bone fractures, you may use a multiple lag screws to fix the fracture, but unfortunately a few times it will still cause shearing or rotational stability may not be obtained. In these cases, you have to use what is called as an additional plate. You will have to use a neutralization plate, which will be an additional stability of the plate. So what are the various ways in which you can use a screw? So before we finish the screw topic, what are the various ways in which you can use a screw? So you can use a screw as a positioning screw, right? Positioning screw is when you use it for the neutral hole of the plates. In the neutral hole of the plate, which does not function anything, just to hold the plate to the bone, then it is called as a position screw. You can use the screw as a compression device, compression screw. Where do you use it as a compression screw? You can use it as a compression screw in lag screw technique and in the compression position of a DCP, right? Compression position of a DCP, where you apply it eccentric and away from the fracture side, where you apply it eccentric and away from the fracture side. So when you apply it away from the fracture side, it can cause compression of the fracture, and this is in compression mode where you apply the screw. The third way you can use is in polar screws. All of you know what is polar or blocking screw, which is used for guiding intramedullary interlocking nails. IMIL nails are guided in the correct direction using polar or blocking screws. The next way you can use it is in locking screws. So we have not discussed locking screw in this video, but of course it's a very simple topic. Locking screw is where the head also has screws. Head of the screw also has threads, Head of the screw also has threads. So this basically locks into the plate, and therefore the screw does not become loose or does not wobble. Whereas if in case the fracture does not unite, the whole of the plate and the screw construct come off as a whole. This is basically used in osteoporotic fractures. Osteoporotic fractures, in metaphyseal intra-articular injuries, metaphyseal injuries, in some of the intra-articular fractures as well. So this locking screw principle or mechanism is used in these conditions. So today we have gone over the topic of screws. Screws can be of various types. If you use the screw in compression mode, that is lag screw or compression TCP, you are trying to achieve primary bone healing without callus formation. There are various other ways in which you can apply screws. So these are the techniques which you can use. Thank you very much.